Hey guys, I hope everybody had a great weekend. We're shooting from a little bit different place today since our gym is occupied. Hopefully you can still hear me, see me. As always, like, comment, put comments, questions in the comment section, and we will certainly get right to them. If you want a free screening or consultation with your physical therapist, I put a link above the video, so you can actually click on that. It's https://tinyurl.com and then fix me TPPT. So just before we get started, that's above the fold. Tonight we're going to talk about how you fix a pulled hamstring. So many of us watching this are Eagles fan, watched the disappointing game that happened, and Josh McCown had an obvious hamstring injury. So it unfortunately, when you're 40, you do feel a lot of things, and when you're a little bit older, the hamstrings do become a little bit more of an issue. So what happened, I don't quite know. Probably a pull, possibly a little bit of a tear, but whatever. We've all experienced that hamstring pain at one time or another. I should say most of us have. It can be debilitating. It can stop you in your tracks. It can shoot down your leg. It can just cause incredible pain. Most of the time, it really will just not allow you to work out. Unfortunately, what happens though is most of the time it will actually correct itself. And by correcting itself, you'll use other muscles to compensate. So you will actually wind up doing more harm than good because you won't ever fix it. You'll just keep doing what you're doing because it'll feel better. And that's really what we go on, is how we feel. This is something we treat all the time here because unfortunately people don't come here until it's 6 months into being not good, or having this pain, or it's to the point where they can't run or can't work out. So this is something that's very common, and it's usually something that does require some therapy, some sort of treatment. Now, if you get it right away and you just pulled it and you feel it, this is where you can do some things at home, but there is a manual component that you do need to have in order to get rid of a lot of this pain and a lot of the muscle imbalances. So it's really important that you make sure you take that appropriate step. So one of the first things that I'm going to tell you not to do with a pulled hamstring is don't stretch it. Do not stretch it. I know it is one of the most popular things to do, and a lot of times what happens is people will allow the hamstring to calm down and it will feel better, and then they're like, oh, I got to stretch it out. I tweaked it yesterday. That's a common word I hear with hamstrings. I tweaked it. And most people feel that they tweaked it because it was tight and it needs now to be stretched. Unfortunately, you're causing it a lot more damage when you're stretching it, especially if, one, you haven't identified what the problem is, or two, you haven't identified why you actually tweaked it. So most of the time you tweak it, or you pull it, or you strain it, whatever word term you want to use, most people are talking about the exact same thing. You are actually tweaking it because of the fact that it's weak. It's not that it needs to be stretched, it's just weaker than a lot of the other muscles. Your quads are generally more dominant, your hamstrings are less. These should be 1-to-1 ratio in terms of strength. That is not the case on most people. I will be the first one to admit it's not the case on me. The quads are generally stronger. Your IT band, all of the complex of the legs and the hip are generally stronger, and the hamstring is the weakest, so it fails the fastest. So when you tweak your hamstring, it's not because it needs to be stretched. It needs to be actually strengthened. So this is the fine line where you don't want to necessarily jump into some significant hamstring strengthening exercises because you will injure it again, but you also don't want anybody cranking on your leg or having somebody stretch your hamstrings out. That is the thing that I can't stand the most. Please don't ever let anybody stretch your hamstrings. There is no need for it. There is no need for anybody to crank on your hamstrings, especially if it's pulled. You're going to wind up injuring it a little bit more. So what can you do? The first thing that you want to do is actually you don't want to rest it. So I'm giving you all these recipes that you don't want to do, and it's very common to do all these things that I'm listing. We treat this really quite often, so it's something that we know what not to do, we know what to do, so I'm going to go through a little bit of things of what to do, what not to do, but you don't want to rest it. That is really a very common misconception. I'm just going to rest it, and it will feel better. I will tell you right now it will feel better. And most of the stuff that you read on the internet, and I know there's a lot out there, it's gonna feel better. You're gonna rest it for 48 hours, maybe a week, it's gonna feel much, much better. You're gonna go back to running, you're gonna go back to the gym, you're gonna go back to whatever you were doing, and it feels great. It doesn't last, but it feels great. So acknowledge that if you take time off, and all you do is take time off, you do nothing to fix it, you just rest it, it's not gonna get better. It will feel better, but it is not better. So that feeling is generally, unfortunately, a very common misnomer in hamstring pain recovery. It's because people think, oh, I feel better, I'm gonna rest it. And then what happens is you get into this vicious cycle, is you'll rest it, and then you'll go back running, you'll run, maybe for a week, maybe for 2 weeks, maybe for a month, and then it'll kick up again. And then you'll do the same thing. You'll take a couple of weeks off, maybe a month off. Nothing will happen other than you just rested it. So your hamstring doesn't need rest, it needs to be strengthened. But again, you need to make sure that you are doing it properly, that you are not going to go in and just start doing bridging and hamstring curls, because you will actually tear it or cause it more harm than it actually is more than it already has. So that's one or the two things that you would not do with a hamstring injury. So the first thing that you want to do is you want to do a foam rolling exercise. So we're going to come on over here and we're going to get our foam roller. So everybody knows this is a spike. There's lots of information right now on the foam roller out there because it's the new year. Everybody posts on the foam rolling and the alignment and how it helps. This is spike. What you want to do is you want to take this and you actually want to get into your hamstring with it. A lot of people have a flat roller. This is not as good. I recommend you have 2 rollers because this one is if you're injured, this one is if you're not. But this one will just kind of compress your hamstring. It's not really going to dig anything out. This is going to dig out some hamstring. So you want to get on this right away. Okay? Now, if you can't tolerate getting on this one, then you get on this one. If you pull your hamstring running down the field and you're on the sidelines, you're probably going to want to use this one. It's really, really going to be tender. Once a couple hours have subsided, you can start to use this one. You're going to get on and you're just going to roll back and forth right over your hamstring. If it's not too bad, you can cross one leg over the other, okay, and put some pressure on there. You're going to feel some pain, all right? So take whatever's comfortable. You may need to just sit down and put your hamstring on it and roll back and forth. You want to go all the way from the back of your knee up to your glute, as that's how far your hamstring goes, from the bottom to the top. You want to make sure that you hit every area, and you want to make sure that you do this about 10 minutes a day. You can focus solely on the hamstring, although I don't recommend it. I recommend that you do the sides, the front, the adductors, all the way around. We have other videos on our YouTube channel that can show you how to foam roll the entire leg, but we're not going to go through that right now. Pay attention to the hamstring. That will help break it up. What you want to do for strengthening is you want to start with strengthening exercises that actually will strengthen the hip. So you're going to strengthen your glute medius. So you're going to do some hip hikes. Nice and easy. It's not this, okay? It's just drop your hip and lift it up. Drop your hip and lift it up. Those are going to help strengthen the hip. It's not going to hurt the hamstring. It's going to allow the hamstrings to stabilize a little bit, but it will also allow some of that strengthening to begin in the leg. Finally, you're going to want to do some manual therapy to it. So this is where you're going to get in, and this is where we are experts in this area. It's really hard to get it out with just this. If you just did it, probably this is going to be fine. If it's 3 months, 6 months old, you're going to need somebody to get into the hamstring. So you're really going to just want to take your fingers and get back there and really work out. You're going to find some tender spots, and you're just going to want to work and rub into that hamstring. It is very hard to get it out yourself because it's going to be painful. And most people can't inflict the amount of pain that it's going to take to dig out a knot. You're going to want to stop. So you need to be a little bit careful also because there are nerves. So you don't want to just kill yourself and cause yourself extreme pain and cause some nerve issues to go down your leg. So when you're working on it, you're just kind of rubbing it and you're massaging it, finding a tender point, staying on that tender point just for about 30 seconds and then moving on. Just be careful that you're not just needling yourself to death and causing yourself nerve damage. If you do have hamstring pain or you are experiencing any sort of hamstring issue and you want a free consultation with a physical therapist, all you have to do is call our office at 215-997-9898 or click the link and that's Help Me TPPT. Follow after tiny URL, and we will be certainly happy to help you. Thanks, and have a good night.